In this video, you'll get a quick overview of the UTI Zoomer test. I'll explain the Vibrant Advantage and the methodology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. It was previously believed that urine was a sterile substance. However, new research indicates that urine contains a host of microorganisms. In fact, the diverse community of microbes living in the lower urinary tract is called the urobiome. A healthy urobiome may prevent and protect against various urinary diseases, including bladder cancer, benign prostatic hyperplasia, overactive bladder syndrome, interstitial cystitis, and, of course, urinary tract infections. Urinary tract infections are among the most common bacterial infections worldwide. The global burden of UTIs is substantial, with over 400 million cases occurring in 2019. This represents a 60% increase from 1990. In the United States, UTIs are a major health concern. Approximately 10.5 million office visits and 3 million emergency department encounters are attributed to UTIs annually. An estimated 20 to 40% of women aged 20 to 40 have experienced a UTI, and the lifetime risk of UTIs among women in the U.S. is over 60%. It is now widely recognized that microbes usually exist in complex microbial communities rather than in isolation. Polymicrobial interactions can promote growth of one species over another through mechanisms such as cross-feeding, cooperation, and immune modulation. In fact, some interactions increase an organism's pathogenic potential without changing its colonization density. Emerging research shows most chronic urinary tract infections are polymicrobial. Vibrant's UTI Zoomer detects a wide range of UTI pathogens and antibiotic resistance genes, and also includes a full urinalysis to help you evaluate and manage overall urinary health. Vibrant's UTI Zoomer is an easy at-home urine test. Patients collect urine using clean catch midstream collection, and the special collection cup lid contains a sharp that allows transfer of urine from the sterile cup into sterile tubes. There are no diet, supplement, or medication restrictions. Vibrant's UTI Zoomer uses real-time PCR methodology to accurately identify UTI pathogens. Briefly, genetic material is extracted and purified from urine samples, and a genotyping assay is performed. RT-PCR is a gold standard for identification of genetic material, so results are accurate and precise. Urinalysis is performed using FDA-approved fully automated Siemens ClinTech Novus and Sysmex UF 5000 instruments. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The UTI Zoomer sample report includes a cover page, introduction, summary with interpretation and supplement suggestion, and then lists all markers. The cover page identifies the sample type and includes the results interpretation key. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page. The summary shows the elevated and moderately elevated results along with interpretation. The summary also includes supplement suggestions with dosages to address the UTI pathogen and urinalysis results. For example, 76 milligrams of cranberry juice per day reduces pyuria by inhibiting bacterial adhesion to the urinary tract due to its proanthocyanidins, which prevent pathogens from sticking to the bladder wall. This lowers bacterial load and inflammation. Additionally, the juice's diuretic effect helps flush out bacteria and debris. And the full report lists the levels of all markers, including pathogens that cause urinary tract infections like E. coli, Klebsiella pneumoniae, and Candida albicans, and antibiotic resistance genes, as well as urinalysis markers like bacteria, clarity, leukocytes, and nitrite. UTI pathogenic species are indicated as not detected in green or detected in red. Antibiotic resistance genes are marked in red if detected or in black if not detected. For urinalysis, the classification of green denotes a result that is within the normal reference range, and the classification of red denotes a result that is elevated with respect to the normal reference range. If you want to learn more about species that are outside of the reference range, you can scroll back to the summary and read the interpretive comment. For example, Candida glabrata is a yeast species that frequently causes urinary tract infections, especially in immunocompromised patients or those with long-term catheterization. C. glabrata adheres to the urinary tract epithelium and can form biofilms, often exhibiting resistance to common antifungal treatments, making the infections challenging to manage. To help guide antibiotic choice, check out the antibiotic resistance genes section. In general, you'll want to avoid any category flagged red, as those resistance genes were present in the sample provided, indicating the antibiotic class will be less effective against any current UTI infection. So, which patients benefit most from this test? The UTI Zoomer is ideal for individuals experiencing recurrent urinary tract infections, persistent or unexplained urinary symptoms such as frequent or painful urination, or lower abdominal discomfort. It's particularly beneficial for those with a history of urinary tract issues or individuals in high-risk groups such as those with a history of urinary conditions. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to the UTI Zoomer, consider the renal function panel, which evaluates kidney function, providing essential insights into potential kidney damage that may result from chronic UTIs or other urinary system disorders. Also, the oxidative stress profile, which measures markers of oxidative damage which can be elevated in patients with chronic infections and provides a broader picture of the patient's overall health. Also, the mycotoxins test, which detects exposure to harmful mold toxins, which can exacerbate or mimic urinary symptoms, ensuring a comprehensive differential diagnosis. Or the total tox burden to assess the cumulative burden of toxins, including the mycotoxins, heavy metals, and environmental chemicals that can impact urinary health and contribute to the severity of UTIs. Or the gut Zoomer to assess gut microbiome health, which can influence urinary health by promoting systemic inflammation or dysbiosis, contributing to recurrent infections. And finally, the Candida plus IBS profile, which identifies overgrowth of Candida and other fungi, which may be related to or exacerbate urinary symptoms, particularly in patients with overlapping digestive issues. In summary, the UTI Zoomer uses highly specific and sensitive RT-PCR methodology to detect a wide range of UTI pathogens and antibiotic resistance genes, and also includes a full urinalysis performed using FDA-approved fully automated instruments. Together, these provide early detection and detailed analysis, supporting targeted interventions and improved long-term urinary health outcomes. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.